Good evening, the aspirants present here. Good evening, Amla ma'am. Good evening, Aman sir. So,
Good
we'll
evening.
be starting with the session. The station for today is communication and it will be taken by Dr. Sangshaptak Saha sir. Sir, you may take over. Aman sir and Amla ma'am, it's going to be an interactive session. So, it's must you can unmute your mics. Thank you.
Hi, doctors. So the mostly what will happen today is that we shall be having an interactive session. So there are two cases for today. So we shall be having like a 20 minutes discussion on the first case with one candidate, and after that we shall be discussing the case about like what went well and what went wrong. So it will be like a you can call it like a mock test only, and the second one but with a like full discussion and follow up. And the second case, the another person will take up the case and we shall be following the same routine, 20 minutes for the like scenario play out, and then around 15-20 minutes for discussion about what went wrong and how to approach such cases. Okay, because in communications there is nothing really to teach as such. It's just we need to practice, and then we need to practice as an active candidate, and the passive candidates also can learn a lot from hearing how it went. So I shall be sharing the screen. So there will be one case, and and I think there are only two candidates. So one of you can take up the first case, the next person will take up the second case. Okay.
Okay, sir.
Yeah. So I think both of you know this. Revised screen. There are two communication stations, 20 minutes each. So communications, and it's only only be an interactive play between the candidate and the examiner. There will be no, I mean, the candidate and the surrogate. There will be no questions asked. So we shall be following the same pattern, and uh, between you two of you just select who will be taking out the first case, and then I shall move on to the next screen which will be showing the case itself.
So I'll take the first one.
Fine. So it's 7:45. So you take 5 minutes to go through the case, and from then we shall start. Okay.
Okay, sir.
Yeah. So there are two slides. This is one slide. Second slide is also of the case. So once you go through this slide, tell me. I should go to the next slide.
Okay, sir. Sir, can you please change to the second slide? Sir, please, for the first slide also.
Okay.
Sir, should I start?
Yes, you can.
So, hello, Mrs. Debbie Jackson. Myself, Dr. Aman, and I'm your specialty registrar doctor. Uh, uh, I want to talk to you regarding the progression of the disease of yours. So
Okay.
you have been admitted to our site with a history of seizures 3 days back. Can you please elaborate how are you feeling right now?
I'm feeling absolutely fine, doctor.
Okay, so basically, it's regarding the procedure, the CT scan we have done for you for the diagnosis of the symptoms of your seizures. So, do you know about the CT scan you underwent for the seizure episode
Yes,
you had?
doctor. I know that I underwent a scan of the head. That's all I know. I do not know about the reports.
Okay. So, I want to tell you it's sad to inform you that there's something in your brain we get in your CT scan. Are you okay with that? Or do you want someone from your family to be with you right now?
No, I'm fine. You can
Okay.
proceed.
So we find something in your brain in your scan. Uh, uh, that will be a possibility of a malignancy or a tumor. We will be working on that for future. We will be working for that. We will doing some investigation for that.
I
Are
did not
you?
get you, doctor. Did you just tell that I have a tumor in the brain?
Yes, sorry to say that we find a tumor in your brain, which is most likely from the previous malignancy you have for your thyroid.
But that
Uh,
was treated with everything that the doctor said. The drugs, the radiotherapy, and the surgery, everything was done. So how do I have a tumor in the brain?
Yes, you have been operated for the thyroid malignancy and you received radioactive therapy also.
Mm-hmm.
But there's a possibility of disease progression and disease dissemination at the time of presentation. So that will be the case that your malignancy has spread to brain at that time, which is now progressed to the fully fledged disease right now.
But the doctor previously had told that this surgery and these things are okay, and I can, like, lead on with normal life. Nobody told me about anything about the progression of the disease possibility, and I think something needed to be told about any follow-ups or something like that. If that was the case, I
Yes,
was not told
yeah.
anything like that.
Actually, generally, the patients for that remains on follow-up for the disease progression. They have to underwent few scans after the therapy and surgery. So,
I underwent the scans. Yes, after the surgery, I underwent the scans. There was no disease.
okay, okay. Anything about your disease, or do you want to ask anything regarding your disease right now?
I am asking that only. I am asking how did I get this tumor in the brain?
Um, there's a chances of the malignancy being undiagnosed or unidentified on skin in early phases. So that may be the possibility that you get the normal skin at the time
So
when you
whose
get the
fault
scan.
is that? I mean, why was I not diagnosed? I did all the scans that were asked of me. It's not like that I did not go to the doctor. It's not like that I did not do the scans. I followed it up. And when the scans were stopped, I stopped doing it because it was not ordered.
Yes, I totally understand your concern, and I totally feel what you're feeling right now. But it's sad to inform you that the scan most likely there is a chance of malignancy with disease progression.
Okay, now I don't know what to say because the malignancy is spread to the brain. So, like, that's it, right? And, is not,
No,
I don't think anything can be done after that.
no. We will be performing biopsy of the lesions in the brain, and we'll decide what the further steps of procedure will be taken. Like if the chances of excision of that tumor is possible, then we'll try to get that tumor out of you.
Okay. So, you mean I need to undergo a brain surgery?
There may be a possibility of brain surgery for that.
Okay. Okay. So, like,
Anything,
a lot to
anything?
take up. Yeah, like,
Yes.
can I go home right now?
Actually, as you have a possibility of seizures and there is a chances of further deterioration, is there anyone in your family to get you from hospital to your home?
Not right now, but yeah, somebody is coming to pick me up.
Okay. I'll be telling you about the symptoms and what to do if you get in another episode of seizures. And we will be planning your next visit soon so that the investigation for that tumor or the mass will be evaluated.
Okay.
And I will be handing you few of your to-do list so that you won't miss anything regarding your disease.
Okay.
Is there anything I can help you with?
No.
Okay, then thank you. It's good to talk to you, and I will be there for you if you need any help from my side.
Okay. So, like, is that the end of the scenario for you?
Uh, yes, sir, sir.
We'll have a lot of time left, right?
Okay, sir. Actually, it's just regarding the breaking the ice of malignancy to the patient, right? Na?
Yeah. But like, you need to ask about the other case things like, right? Like the social history, not the history, but who
Okay,
is
sir.
living with,
Okay, sir.
any work history, any, those
Yes,
sort
sir.
of.
Yes, sir.
Yeah.
Okay, sir. I am